Republic of Congo is widely considered to be the richest country in the world in terms of mineral and natural resources. Its citizens are among the poorest on the earth. Malaria is the number one killer of children and accounting for approximately 40% of child deaths. The DRC accounts for 11% of all the malaria cases in Africa. John Woods here has over 2 decades in orthopedic spine surgery. That's how the name Upright. And as a first assist, and he has worked globally with top surgeons. He has assisted in 11,000 plus surgeries and pioneered patent pending spinal implants and minimally invasive devices. In 2011, a medical mission to the Democratic Republic of Congo transformed his life, shifting his focus from medicine to humanitarian work. Now, John resides in the DRC, visiting very briefly his family in London, and he mostly works in an assistance role with locals, doing all the medical care whilst he is helping them to raise the standard of care. So what does Upright Africa do? Upright Africa empowers local medical professionals, educators, and village chiefs to provide education, supplies, and financial aid, and they strive to rebuild a sustainable future for a nation plagued by war and corruption. John Woods, welcome to Chizuba Talks.
Thanks for having me.
Absolute pleasure and absolute honor. John, tell us, what inspired you to start Upright Africa? Is it that visit? What changed in that visit?
In 2011, I took a trip with a colleague to a place called Panzi Hospital in Congo, and we did a bit of a scout mission. At the time, as you said, I was involved in orthopedic spine surgery, and we noticed that there was a huge lack of care in spine. So my colleague asked me to come for a visit, which I did, and as soon as my feet hit the ground, I recognized the huge need, because this was kind of a higher standard hospital, and yet they were operating in conditions that were very difficult. And I recognized that what we throw away in a day could help them to function probably for a month of surgical time. So upon that visit, I started collecting material from the hospital I was working at and started putting everything together and started to make some trips myself over to DRC and just bringing these supplies to help these guys improve their standard of care. Things like cautery pencils, which they didn't have. Sometimes they don't have cautery machines, lack of power, lack of just about everything. So my initial visit was the spark, and then it grew from there.
Wow. So you are a spinal surgeon, and when you went to the DRC, you saw different ailments. What was the most prevalent, and where were your services needed most?
Because I have, as you said, I have a lot of experience in surgery. I recognized where I could impact the most, which was to start with surgery. Simply by bringing machines, as I said, cautery machines and ultrasounds and smaller stuff that could travel. And it grew to an organization now where we have a warehouse in Texas housing operating tables, beds, anesthesia machines, and a plethora of different machines and soft goods and equipment to help improve the standard of care in surgery. There is really not any spinal surgery happening there. So I work specifically in a role to help the on-the-ground Congolese doctors and nurses do what they're comfortable doing. For example, we do many surgeries for hernia. We do a lot of gynecology care. We do a lot of pediatric care and different types of medical care that they're familiar with, but simply don't have the necessary tools or material to do a job at a higher level. So we're bringing in all this material. We're financing some surgeries right now. We can average around $150 per surgery, whether that's a thyroidectomy, if that's a hysterectomy, if that's a hernia, if it's a lipoma, anything across the board, we average around $150. So I think my years of experience in the medical field in the States has allowed me
Certainly.
to understand the global approach, put together these surgical campaigns that we're doing. We're able to do between 20 and 30 surgeries in a day after several weeks of prep work. And that really helps to increase our volume to impact the population. Currently, I just left a place called Goma, which is in a war zone, and we did a campaign specifically for internally displaced people, or IDPs. So they're all refugees. We did 174 operations in 6 days. Thankfully, all the patients were doing well. And my team consisted of myself, my local surgeon, my local gynecologist, my local anesthetist, 2 local young doctors, and then the entire team of the hospital where we operated. So that helps us for our empowerment and sustainability. My Congolese doctors and nurses will come in and help train the existing staff so they can carry on and continue doing the work themselves. Of course, after one mission, they can't start doing some of the bigger operations, but at least it gives them an idea that it's a possibility, and that they have hope. They have hope that they can at some point do these things themselves without our support at all. That's the goal.
Let's take a break to understand what Chizuba is. Everyone at some point ponders on how this beautiful life can be made more meaningful. Maybe you're a leader trying to enhance your employees' experience at your organization. Or you already work for the community and seek volunteers with state-of-the-art skills to strengthen your nonprofit. Whatever your situation, know that you can make a difference. Chizuba began with this very vision, a vision to facilitate every skill and every passion in the world in meeting a social need. Corporate volunteering has several benefits for both businesses and organizations. In parallel, experienced and enthusiastic volunteers join NGO workers, enabling them to serve the community more effectively. Chizuba offers everyone looking to add purpose and meaning to their lives a chance to connect or volunteer virtually with nonprofit organizations from over 100 countries around the world. Visit www.chizuba.net and explore opportunities to find meaning. Chizuba, your platform to do good. And now, back with our guest.
Civil strife and instability, you keep going and you keep giving hope to people. So that is a challenge, definitely. In terms of resources, what are the challenges you face, and who is helping you out with those?
Currently the president of the organization, I'm the founder, is Charles Johnson. He's out of Waco, Texas, and he has been supporting me for years, and has used his inner circle also to help with financing and getting different materials donated to our organization. So that's where our headquarters are. So he houses a lot of stuff, and we're slowly sending containers over, maybe 1 or 2 a year. Now that we have a warehouse in country. Of course, my wife, my family, my children are all very supportive of all I do, which allows me to go back and forth and be gone for months at a time. Some days are easier than others. As you said, I'm currently in UK with my wife and youngest daughter. I have 2 older daughters that are in the States. So I don't get to see my family as much, but their support allows us to be on the ground. And ultimately, that's the key to success, is to walk a mile in another person's shoes, to understand the challenges, to be involved in the solutions, and not to give them the solutions, but to work with the Congolese team hand in hand and to come up with solutions together. So they're ultimately solving it. We're just kind of giving them that little step up to get to the solutions themselves.
Yeah, that's you being humble. Well, thank you to your family as well for being so supportive. A huge shout out to them on this podcast. John, given that malaria is the number one killer in the DRC, so what are the measures that Upright Africa is taking to combat this situation?
It really is a shame. 1 in 4 children don't reach the age of 5 because of this specific disease. Um, I have experienced malaria multiple times myself, and in fact, my first bout with it, I nearly died. I ended up on dialysis. I had blood transfusions. I lost 40 pounds. I was in the ICU for 23 or 24 days. They had called my family in from around the country to come say goodbye, basically. So really, the resources and the treatment of it, it's less than $1 to treat these children. And being on the ground and giving the solutions directly in place when it happens is the only way to do it. Talking about vaccines and all these other things are great, but if you're not within the country itself, it's a useless situation for us. We need medicines, like I said, can be less than $1 a day. If it gets to a certain position, sometimes they need blood. We have a hard time doing transfusions because there's no power in the bush anywhere, so they don't have blood banks. They don't have things like that, although we've donated some solar-powered blood banks and continue to do so. But it's preventative medicine is the best. Let's get them mosquito nets. Let's get them the vaccines that they're trying to work on. If we get a vaccine, let's get it distributed into these rural areas that no one's willing to go to. Upright Africa is on the ground, and we're in these areas and in the position to deliver what's necessary for these children.
So, John, you're trying to empower the local community, and you have multiple areas where you require help from them also, right? So what kind of help do you expect from the communities, and what kind of help do you expect, or do you look forward to from people who are listening to this podcast?
Okay, so the goal for us is try to look for funding and support from within the country. As you said in the beginning, it's one of the most mineral-rich countries in the world. So there's mining, there's not really tourism, but there's many businesses. There's a lot of access to funding within the country. So we do our best to look internally first. I work hand in hand with the government, so we're transparent. We're all the way to the top. We're recognized by the national healthcare system. So our goal, as we said, is empowerment and sustainability, and that can only be done if we're doing it with Congolese for Congolese. So our teams are made up entirely of Congolese. I'm the only expat. We're having Congolese doctors, nurses, anesthesia, whoever it may be, teaching the next generation of Congolese. We're also sending out several of our team members for advanced training, doing their residencies in either Cote d'Ivoire, Benin, Uganda, Senegal. So we're getting them sent out for their 5 years of residency, and then they come back to help train the future of Congo. And ultimately, hopefully they will lead this organization into the future. So currently it's being funded a lot by partners in U.S., partners from around the world, and that's essential to get the ball rolling. So anyone that's interested in getting involved, as I said earlier, it's $150 to do a surgery. We're also drilling water wells. We're bringing in food containers. We've already brought and delivered 80 tons of food. We have 40 more tons sitting at the border right now for the refugees. So we're accessible on our website. People can reach out to me directly. It's a very unique setup so that if someone were interested to do some donations, I can literally connect them person to person, which is always nice. I have some donors that help some children with malnutrition and have literally saved the lives and watched these children go from near-death experiences to now going to school and hopefully moving on to a career in the future. So I'm very accessible. I'm open to any suggestions, and I'm working from within the country and without the country, whatever we can do to help some of the most vulnerable on this planet.
Absolutely. You are doing a wonderful job, and huge respect for what you do and how you do it. It's not easy to, most people feel like helping somewhere. Most people feel like doing something, but very few take the steps to actually go forward and do something. So you are one of them, and thank you so much for sharing your experiences, for sharing your dedication to improving the lives of the Congolese people. Upright Africa indeed is truly inspiring.
Wonderful. Well, thank you so much for having me, and I'm looking forward to hearing back from people.